up, everybody? Welcome to Dental Pearls TV. We are your hosts. I'm Smiley Jackie.
And I'm Mariah Moeller.
And this is the internet's most passionate dental program. What are we doing today, Mariah?
It is Dental Pearls Anatomy Edition.
How you doing today, Dr. Hoffman?
I'm good.
You got your coffee?
I had iced tea on the way in, so that's like a good moderate caffeine for the day.
Perfect. We are joined by our incredible guest, Dr. Hoffman. He's really carried us through this last semester and taught us so much. Mariah. Yeah, all things important to dentistry and maybe some things not so important, like the abdominal cavity, but we'll do it in the end. I guess it all comes together in the end, so yeah, good stuff. But yeah, the amount of knowledge I have gained from January 1st, 2022 versus now, it's insane to think how much I didn't know and now how much I knew. I came into the semester not knowing what superior inferior meant, so it's been a long, she's been a journey already, but it's been quite the journey across the board. But yeah, Dr. Hoffman, do you want to introduce yourself?
My name is Darren Hoffmann. Many of you who are watching probably have met me before. If you haven't, I'm a professor in the medical school here, and I have the privilege of teaching in the dental courses. So I teach for the dental gross anatomy course in the spring of the first year. It's an integrated course with anatomy and histology kind of fused together, which makes it like a monster, right?
Yeah.
But it's a super cool class, and I think the two subjects really benefit from each other. I've been teaching that class since I was a grad student, so that's been 17 years that I've been involved with it. And I've been directing it for like 15 years. So it's just been like a big part of my life, basically, as long as I've been an adult.
Oh yeah, I'd say so.
And I love it. I love teaching dental students. I've had all these years to become a specialist in head and neck anatomy. It's not how I started. I used to think that like the limbs were the cool part of the body. Not anymore. So you develop that kind of expertise as you teach it again and again and again. But so yeah, that's probably what's most relevant to our conversation today, but I'm also a whole lot of other things that we'll talk about a little later.
Yeah, stay tuned so you find out what those other things are.
What's one of your favorite hobbies?
I am an anatomist in my profession, of course, but my first love was music, and I have kept that alive over the years, against all odds. So I still do pretty much play the piano every day for some time, and in the last couple of years I've developed some more courage, and so now I try to sing with myself every now and then.
Oh, so you use this
I
thing?
do. I use this instrument. Whoa. Yeah, my larynx.
Wow.
It's not this big, but it's a work of art nonetheless.
Yeah, inside the pharynx.
Yes.
Right?
The larynx and the pharynx. Yeah.
You will learn about this too.
Yeah.
All right, so now time for the real question.
Oh.
What do you think of teaching medical students or dental students? Which is better?
Oh. Well, had to see this one coming.
This is Dental Pearls TV.
Right. Like there's obviously the right answer to this question.
They're biased.
Yeah.
No, I'm just kidding. It's all you.
Yeah, no, like, I mean, in many ways you guys are the same. You know, like you're super smart, you probably had similar educational backgrounds, and like those basic characteristics, more often than not type A, more often than not like good at memorizing. You know, like there's these strengths that bring you to medical school and dental school, and they're basically the same thing. So I'd say some things that are different. Dental students tend to be a little bit more chill than medical students, I would say, just like out of the gate. But that might be biased because I work with you guys mostly in the spring. So I don't know if you guys have like a fall freak out period where you kind of like become chill, or if that's just your vibe.
I feel like once all of our classes started, or like, because we kind of like eased into it, and then in like October it was like, okay, now we have every single class, test every other week. Yeah. I think that was our freak out period. Yeah. And then we're like already in the grind.
Yeah.
After break. Yeah. So I think maybe, we already had our freak out period.
That's a good answer. I was freaking out the whole year, so I'm not the best example.
Oh,
but
sure.
that makes sense, yeah.
Yeah, that'll probably be with you forever, Jackie.
Yeah, probably.
Yeah. So that's one thing. I would say, in general, like dental students are very attractive, and I wouldn't say that they're like in any way more like quantitatively attractive than medical students, but you can count on dental students to always have good teeth. You know, and even if they're a work in progress, they're clean. You know, so that just like adds to the attractiveness quotient for sure.
Yeah.
I would say like philosophically, dental students are very aware of the role of money in their career because they understand that they're running businesses when they leave school. Whereas most or many doctors will not. Like they'll work for healthcare systems where they don't have to, find their own clients.
Sure.
You know, and I think most dental students are very aware of that, and so they have kind of a mindset about finances and business that's very like mature. And I would also say that sometimes medical students have more of an idealism about like wanting to save the world. through medicine, right? Because like there's this very common like, you know, Doctors Without Borders, global medicine, you know, saving lives, you know, in the hospital. Like it's just kind of a different set of stakes, and I think it makes you think about your profession a little differently. And I think that dentists often think about themselves as saving their communities. Because often dentists are like a part of the fabric of a community that helps to serve a specific group of people rather than like saving the world as an abstract notion. You know, and many first-year dental students even know like I have a town picked out where I've been working with a dentist who's going to be retiring in a few years, and so you know, they even have that very specific vision of like of a single community. So I think that changes the nature of how dental students or medical students like respond to education, how they, you know, think about their future, their determination, what they want to get out of it. I think those are all really, it's all colored by that perception of what you're going to do.
Wow. That's really cool that you can see the differences being an anatomy professor and teaching future doctors. That's really cool.
Well, you know, 15 years is enough time.
Enough time to see that. You've already seen like what they go on to do, and that's awesome.
Wow, there must be certain like characteristic types among that you've noticed that helped you make this epiphany. So that's actually really cool.
Yeah, it's true. And I think the way that I can use that knowledge is that it's like with the examples that I use or the motivational strategies that I might use, like I would teach you the same thing, but I would say like, this is something that's going to help you take care of your family, or this is going to be something that's going to help you take care of your community. Whereas like with a medical student, I would be like, this is going to save somebody's life. This is, you know, you just have like a different like carrot that you're dangling for the student as to make them care if they don't.
And in terms of like the difference between how you teach the medical and the dental students, could you tell them what was the biggest difference in terms of the anatomy curriculum?
Sure, absolutely. Yep, very easy. So in the dental class, we do not do the pelvis or the lower limb, and those are included in the medical anatomy class. So what we do with that extra time, because they're basically the same length of courses, is we just spend extra time on the head and neck. So we do a really quick speed through the thorax, abdomen, and the back and the upper limb. Those are all things that are useful for dentists to understand, but it's not the core of where you work, right? So we get through that in about a month and a half. And then the rest of the whole course is head and neck. And so I love that because that means we get to do everything more than once and from more than one perspective. So when you finish, it's really impossible for you to have not learned it. I don't know how you could have gotten through the class without really becoming a master of it, because you've learned it from, you know, a regional perspective, a systemic perspective, a vascular perspective, a neuro perspective. So you really do become head and neck masters.
That is really cool. Because I know a lot of dental schools I've looked into also, they take their anatomy with the medical students, but I have a feeling that you were part of the reason that we get to focus and become experts in the head and neck. Is that right?
Definitely. Over the 15 years, we've just kept leaning harder and harder into head and neck emphasis. And for comparison, in the medical class, we spent 5 weeks on the head and neck. And you guys spent like 2.5 months. Which is, I can't do math, but I think that's like 10 weeks.
And like each week is like 10 hours of Gristo at least.
Significant.
Right? So,
It's a constant stream of effort.
I felt like this was the only class this semester because we were in this room so much studying. But
it's true.
No, it was good to be masters of the head and neck, because then right after we learned all of that, then we went to our anesthesia practical, and it was like old news.
I love
we're
that.
like, we know what we're injecting, we know what's going to be known, we can see it, we can visualize it. It's great.
And you don't know it because somebody told you what was going to happen. You know it because you can see it in your mind's eye. You know, and you have that picture. And that's the best gift that I can give you. So I'm so excited that you got it.
Yes, it has been received and stored away.
I hope your next gift, though, Dr. Hoffman, is that you get to build your life-size PPF.
Yes.
That we can look at all of the foramen through.
I know.
When is that going to happen, do you think?
I don't know. It's like I need to get some collaborators who are experts in material science, so we can figure out how to make something like that is light enough to actually build it, but also heavy enough to not roll away. You know, a giant skull that you can crawl around and play in. That has the potential to be a massive construction project.
Or we can just shrink down and become a magic school bus and go inside that skull.
That is very true too. I would say if there's any viewers out there, if you know someone who's a material science major or knows about that, if you want to leave a comment or contact us, we'll put you in touch with Dr. Hoffman, and maybe we can make that dream come true as well.
And DPTV will come back for another special of the life-size skull.
Next time inside the skull. Right, next episode. That would be really cool.
See you in the skull.
And what are your favorite skeletal landmarks?
Well, since this is a dental conversation, we're going to focus on a dentally relevant landmark that's my favorite, and that is a landmark called the pterygopalatine fossa. Absolutely my favorite place. Hard to spell, which I love. but it's a place on the skull. The reason I love it is that you wouldn't even notice it was there unless someone showed it to you and made you look at it. Because I think it's one of those things your brain just kind of fills it in. And if you looked at the side of the skull, you wouldn't even notice that there was a space in there. But if you look way in there, there's a tiny little recess in there that, I mean, seems pretty inconsequential, right? It's like your maxilla and your sphenoid don't quite meet. It's just a little gap. Turns out that's where all the nerves for your upper teeth come from. They all go through that space. All the blood supply to your upper teeth goes through that space. All the blood supply and nerve supply to your nasal cavity goes through that space. So, so important. And it's just so easy to not even see.
Wow. Amazing.
Dr. Hoffmann, what is your favorite organ system?
Favorite organ system has to be the nervous system. And it's definitely a huge focus of our class. We've learned all the nerves of the head and neck. Every single one of them.
Yep.
And I think that the nervous system is so interesting because everything else is essentially just inert without the nervous system. And it's super complicated, which is kind of fun for me because it's intellectually stimulating. And I wouldn't be surprised if by the time I'm dead, everything that I know is wrong.
No, I think it's really cool too in the nervous system how like small some nerves are that play a big role, and then how big some nerves are.
Totally.
Yeah.
Some of them are literally like as big around as your finger, and some are like your hair.
Yeah.
But they are exactly the same tissue. They work the same way. It's amazing.
And nerves are tough actually, because that's how you can tell if it's a nerve if it doesn't break.
Yeah,
right?
exactly, right?
Yeah. So even though they're tough,
it's called the pull test.
Yeah.
If you pull it and it doesn't break, it's real.
Well, Dr. Hoffmann, thank you for coming and doing this cool video with us today. We really appreciate it. And we just wanted to end the video with what are your 3 dental pearls you want to give to our audience today? And Mariah will tell us what a dental pearl is.
Yeah, a dental pearl is just a piece of advice that you live by, what makes you you, and yeah, just tips you think would benefit everyone else.
Okay, number 1, always tell the truth. That might seem really trite and simplistic and dumb, but it really makes your life easier if you just don't have a double life. And you don't have people that are expecting things from you that aren't real. So that's for sure always, just tell the truth even if it's hard. It's going to make your life easier. Number 2 is always follow through. Like if you say you're going to do something, then do it. It's kind of like telling the truth, right?
Yeah.
But with your actions.
For sure.
So like if you, I think it's just a way to like have good relationships. It's a way to be good in your profession. And you get into trouble sometimes where you maybe commit to more than you can do, but you can always follow through by being honest with the people that you're working with and say like, I bit off a little bit more than I can chew, check the honesty box, and then reset the target and say, I'm gonna get this done for you, but it's gonna be about a week later than what I thought. And that is still following through, and it's still being like a transparent and good person. So that's definitely another one. The third thing is accept people exactly as they are. Like you don't know why that person is letting you down today, and why they aren't, what you would hope for, what you thought was going to happen. And there's a good chance there's a totally valid reason why they are less than perfect today. Just like there's a good reason why you're less than perfect today. So that's my third piece, and I think that is my superpower, is my ability to just accept situations as they are, people as they are, accept myself as I am, and you're just never disappointed. It's like your whole life is just full of positive surprises.
Wow. That's what we like.
That's awesome. That is quite the way to live. I love that.
Yeah.
There you go. Gentle pearls from Dr. Hoffmann.
I love that.
Activity for today, we are going to be making what, Dr. Hoffmann?
We're going to make origami tea.
All right, and this holds a special place in my heart because during Cadaver Lab, we had a competition to see who could find the most nerves, and my group won. We found, I think, like 26 or something. Yeah,
all the ones that were on the list.
Yep.
We got them all.
So that was really satisfying, and Dr. Hoffmann came the next day with nicely folded origami teeth. So we thought it'd be fun to learn how to make them.
Sure. Yeah, totally. So this is a model that I learned on YouTube from Layla Torres. So we're going to start by just holding it's called a water bomb base. It's called a water bomb base. It's like a starting point for a million different origami models, where you're going to do 2 diagonal folds with the color inside out.
Wow. All right, Dr. Hoffmann.
Mine is beautiful.
Dang.
Paper, looking good.
It does look good. All right, you can show mine. It's a third molar.
Yeah, it's a little roundy moundy on the top.
Yeah.
Rough occlusion on that one.
Yeah, rough occlusion. Had to make it realistic, so.
I love it.
So what number is yours, Mariah?
I'm gonna go with 1.
1?
Yep.
Yeah, that's fair. Then I guess I'll pick a 16 or something. Okay. Not a third molar.
Okay, I'm just
How
gonna
about
say
you?
1 because I don't really know how to count to 8. But so it's 1 to 16.
Yep.
And then 17 to 32.
There you
17, 32.
Okay.
Yeah.
Yeah. Okay.
That's
But I don't know. 1 seems safe because you're starting at the back, right?
Yep.
And this is
upper
definitely
right.
a molar too.
Yeah.
Yeah.
Yep. Got it.
Okay.
That one looks nice and straight though, so probably more of a 2 or 3.
2 or 3.
right?
Yeah.
Yeah.
Well, it doesn't have a cusp of care belly, so.
Oh, that's
Probably
true.
okay.
You might need to add an extra cusp right there.
Oh.
It could be like just
Okay. Nice.
Yeah. He's like, sure. Okay.
You can have that.
That's awesome. Well, thanks for showing us. That's so
Yeah,
cool.
awesome.
Wow.
Cheers.
Cheers. Yeah. Thank you so much from the video earlier, like from the class of 2025. We are so grateful to have had you as a professor this semester. We've been hearing incredible things about you since the beginning of last semester and even through like admissions emails. So thank you so much for putting an insane amount of time into, growing us, because we've already seen the growth in such a short amount of time. So thank you.
Oh, wow.
Thank you. Yeah.
You're
Really
welcome.
appreciate
You're
it.
very welcome. It's my pleasure. I have the best job in the world. And thank you for having me here today. This is super fun.
Yeah, of course. And just remember that no matter where you are or what you're doing, we believe in you.
Yes, we believe in you. You can do it. You
Will succeed! Thanks, everyone!
Please don't forget to hit that subscribe button.
Woohoo! We gotta do that again.